Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
additional actions of beta blockers. Nitric oxide beta blockers producing nitric oxide are celiprolol, cartiolol, bopindolol, nepranolol, nebivolol. These will produce the nitric oxide. Then beta 2 receptor agonists are celiprolol. Beta 2 receptor agonists include celiprolol, cartiolol and bopindolol are beta 2 receptor agonists. Then we have alpha 1 receptor antagonists. Alpha 1 receptor antagonists include carvedilol, labetalol, then we have bucindolol, then we have bivantolol or nipradilol. So alpha 1 receptor antagonists are carvedilol, labetalol, bucindolol, bivantolol and nipradilol. Next we have calcium entry blockade. Calcium entry blockers, beta blockers which can block calcium receptors also. These are actually bitoxolol, bivantolol, carvedilol. Beta blockers with potassium opening property are tilsolol. Beta blockers with antioxidant property is carvedilol will have antioxidant property.
thank you and thank you for watching.